McKenzie is a former Premier League footballer and professional boxer and a speaker now on mental health. We're also joined by the Shadow Mental Health Minister, Dr. Rosena Allin-Khan, who's also an A&E doctor, and Katie Alpin, who's the interim chief executive of the Money and Mental Health Institute, a charity focused on financial difficulty and mental health problems. A very warm welcome to the programme to all of you. Thanks for joining us on such an important issue. If I may kick things off with you, Dr. Rosena, just your reaction really to the findings of our Sky News poll.
Well, it's been a very, very tough time for everyone. There isn't anyone who hasn't had their life touched by the virus in some way. So it comes as no surprise to me. And I feel, though, that as a country, people have stood incredibly well together, fighting the virus together, doing what they need to do to keep each other and their families safe. But it is understandable now that going into a long, dark, cold, lonely winter, people are worried, people are concerned. And we have to hold on to hope, though, that this will not last forever. But there are people who have been living under local restrictions, unable to see the ones that they love, people who have lost their jobs or are facing unemployment, and understandably, lots of people are concerned.
OK, let's bring in Leon McKenzie then, and your reactions and reflections as well. When we hear people talking about in great volumes that they are feeling sadder as a nation, you know, we're in a dark place, aren't we?
Very much so. It's expected for these, you know, for society to be feeling the way it is. I know so many people, even including myself, being made redundant. Obviously, I'm in the fitness area at this particular moment in time, and my gym was having issues, so I got made redundant. And there's so many people, friends and family that have been made redundant, which brings in a financial pressure, and it obviously affects people's state of mind. Just like looking forward, the virus is the main thing that we are trying to control collectively, but at the same time there are a lot of people who are really suffering and having that worry to not know what's ahead. And I'm myself not very good with the unknown. I like to have structure in my life and a routine as such, and I just feel that it's a little bit all over the place at the moment in every area.
Absolutely. Katie Alpin nodding away there. And of course, all the signs are, certainly from an economic standpoint, that things are going to get a bit more rocky in the coming months.
Sadly, that is the case. And I think seeing your poll there, 28% of people telling us that they're worse off financially, probably is sadly the tip of the iceberg. And we do expect further job losses and redundancies as we come into the winter. And for our mental health, that's really worrying. We know when people are going without essentials or struggling to make bills, pay the bills, to make ends meet, that can cause really serious distress, especially when creditors start calling for payments or threatening to send bailiffs around. It can chip away at people's self-worth, and over time that can sadly contribute to people feeling very mentally unwell and even suicidal. 100,000 people in England alone each year attempt to take their own lives while in problem debt, and we're really worried that without support, sadly that number might grow.
Well, look, throughout the course of the next half an hour, we really hope to, with this experts panel, this panel of expert opinion, we're able to guide you and give you some hope with these difficult issues. Let's hear from one of our viewers, Ben West. He's in Liverpool, and he can ask a question to the panel now.
Yeah, I'm a student in Liverpool and have been forced to isolate just one day after arriving. I'm alone in a flat, but I'm able to look after myself and I know how to cope. I really fear for those people who are not able to cope on their own. I categorically believe that we should never have been asked to return to uni, as it totally ignores the mental health of the student population. What does the panel think?
OK, Ben West, thank you very much for putting that so eloquently. Well, I'll ask that question directly, first of all, to Leon, because, of course, I know you speak a great deal about mental health and positivity as well. But the situation with students has been really excruciating, hasn't it?
It's really hard. I have 5 beautiful children. My girls, one of my middle daughters has just started secondary school, actually. Although it's a little bit different to university, it was still a big step for her. She's been sent home twice, 2 weeks at a time, because of this pandemic situation with one of the pupils getting the virus, or there's some alarm of it. and she's been sent home twice, which has been totally unsettling for her. Some kids are at school, some kids are not. Like I said, it's really all over the place. I just feel like we need to get some sort of consistency from whether it's government related who make these decisions to, like, are all the kids allowed back at school or they're not, or like what? I just don't know what's really going on to bring that sort of, like you say, kids of that age, and I've got teenagers, they are being affected. It's not just adults. Teenagers are being affected mentally because they actually don't know what's really truly going on.
Dr. Allin-Khan, it's been so crucial, hasn't it, to get those schools back open, not only for their well-being, but for the well-being of parents who have been working under incredibly stressful conditions, trying to homeschool and field the demands of work. That being said, though, it doesn't mean that the problem is solved. As Leon was saying, lots of kids being sent home. And as we've heard from Ben there, students effectively imprisoned in their halls of residence.
I mean, this has been heartbreaking, and really what Ben is describing is so many students across the country are going through this. And I remember, my Freshers Week feeling really daunted, leaving home, moving somewhere else, trying to hold down a part-time job, but also really excited that I was going to be starting a whole new stage of my life. So you've had parents who've been, sending their children to university quite comfortably because the government said it was fine for students to go back. And this was predicted and predictable. We know every single year students start uni or go back to uni in the September-October period, and the government had an opportunity to get the test, track and isolate system in place in time, and they didn't do it. And now you have young people who are basically trapped in halls of residence with people they don't know, parents going out of their mind, really, really worrying for their children and their little young people, in their lives who they've just basically sent off to start their learning journey. And now people are having to send for like food parcels. They don't know whether they're coming or going, and it's affecting their mental health. And Gavin Williamson himself, the Secretary of State for Education, he said that he knows that students' mental health will be affected at this time. Yet the government have done nothing. So as a Labour Party, we have called on the government to put an emergency package of mental health support in place for students, to work together with the universities to provide them the support that they need. Because quite frankly, what's going on right now for Ben and his colleagues and his friends is unacceptable.
And Katie Alpin, just finally on this subject, I just wonder if there is a sense, or a possibility at least, that the students may be able to bond over all of this, that it could actually be an incredibly, I don't know, not to say positive, but could there be any positives we can find for them in this situation?
We certainly know that this generation of young people are, I think, more aware of their mental health than young people ever have been before. And I really hope they can find resilience in their new friendship groups to get through this. But I think it's also important to mention that actually managing money is probably a challenge for many of these young people as well. It's hard enough when you're trying to do that for the first time as a student or when you leave home. But trying to do it under these circumstances, when many of these young people won't be able to get the part-time jobs that they might previously have been relying on, will also be an issue. And it's really important that universities and the government offer support to these students in that sense as well.
Well, let's stick with that theme then, talking about finances a little bit there, and hear from our next guest. Our thanks to Ben, the student, and we'll bring in Karen James, a landlady from Gloucestershire. Let's hear from you.
Hello. I own a beautiful public house in Gloucestershire, which is renowned for being the hub of our community. As a landlady, I am counsellor, social worker, marriage guidance advisor, mediator, joker, and obviously a friend. I now see on a daily basis the impact that the current rules and laws are having on people's mental health, and it's totally heartbreaking. I worry for my own financial future. So what can be done to support communities and people like myself?
OK, Karen James, thank you very much. Let's put that question to our panel. And to you, Leon, first of all, absolutely heartbreaking then that there are otherwise viable businesses that are going through so much pressure and strain.
It's so sad, honestly. I totally show empathy towards that. Obviously, I'm in the fitness industry, and my gym went into liquidation, where a lot of coaches were made redundant. And that uncertainty of just like not knowing, like I know that many coaches at the moment are still trying to get new jobs and there isn't any jobs available, which like I know that, you know, with mortgages to pay and like bills to pay, this is like a big worry and a strain on if there is no support. It's like these people will go into like a bit of a dark place and try and deal with everything themselves. And I think what we've got to try and figure out is what can we do to maybe put investment into communities and put money into the right areas to try and really push and put mental health to the forefront, because I believe that we can put money into these particular areas and potentially save lives just by listening to people, because I don't think we're doing enough listening. We're hearing a lot about the virus, and granted, totally understand that, but we're also losing lives every day to suicide because people are falling apart.
Yes, I want to bring in Kate Alpin, because this is your area of expertise. Of course, look, we've heard an extension of help from the Chancellor today being offered to those people who are being put under further restrictions. But of course, that doesn't actually affect Karen James. She's not specifically herself in a lockdown yet. Do you think there needs to be then more widespread help, not just this targeted help for people whose businesses are being directly affected, but more widely, perhaps, as Leon suggested, in terms of mental health provisions?
I think making sure people can access practical help and support both with their financial challenges and with their mental health is absolutely essential at this time. You know, it's interesting listening to Karen that actually the concerns, it seemed to me, she was expressing were most about the friends and you know, visitors to her pub that she's providing that really essential support of a listening ear to. Some of that will be because those people are facing financial difficulty as a result of this really difficult economic situation. Now, we know the Chancellor has made support available to people. Of course, that is encouraging, but we also know that too many people are falling through the gaps. And for those who aren't eligible for example, the furlough scheme, universal credit is really low. And it can be a real struggle to make ends meet when people haven't had any warning this situation was coming or any time to adapt their sort of standard of living and the circumstances to the situation they now find themselves in. So it's really important that government make it as easy as possible for people to get the financial support that they need and that they are entitled to, and also make sure that people can access mental health support services when they are in distress and they need that to be available to them.
Okay, Katie, thank you. And thank you, Karen James, for raising that issue and speaking to us this evening. We've also had lots of emails and WhatsApps over the course of the last 24 hours. We've selected a few, and I just want to pick this one from Lottie. She said that in January, my beautiful child arrived. He was absolutely perfect. Congratulations. I understood the next few months were going to be a challenge, but nothing to what I expected. I've been alone at home with postnatal depression, and lockdown meant I could not get support from loved ones. I can't see the joy in my day at all. The lack of contact and support at such a vulnerable time has really had an effect on me, and I just hope that one day I will be back to me. What should we do to stop this from happening to other mothers? And I have to say, the sort of sentiment we've heard so much of through our emails. It's the lack of human contact. It's those people who are particularly vulnerable, new mothers, those that are going through labour that have really struggled. So, Dr. Allin-Khan, your response then to that point?
Firstly, I think Lottie is so brave for speaking out. And I remember not too long ago being a new mum and all of the anxiety and stress that brings just in normal times. So my heart goes out to new mums at this time, so many of whom are giving birth without being allowed a partner there, feeling anxious because they can't go out and take part in the groups that they would normally get so much comfort from. I mean, I remember my maternity leave, I felt like I was, getting motherhood wrong with a whole load of other mums at the same time, and there was a real sense of camaraderie. But I work as a doctor, I'm an emergency doctor, and I see new mums coming in all of the time who are worried and anxious that they are not feeling right. And it's extremely lonely for them at the moment. And we know that if you are lonely, you are 5 times more likely to be anxious, which is why it's so important that we're having discussions like today so that people understand that they're not alone. But I think when we think about supporting people's mental health in the community, we have to make sure that there is no one group left behind. We can't just focus on people who might be losing their jobs. We can't just focus on people who are, working on the NHS frontline. We have to remember that there is no one's life who has been untouched by this virus, and that particularly includes young mothers or, families with very young children who are just struggling to sort of understand what the future will look like for them and their children. And we have to really recognise that this is something we have to take on board and do something about.
Absolutely. And on all of this discussion, I kind of want to finish certainly with Lottie's example as well, with coming up with some solutions, some ideas of how things can help. And I know, of course, Katie, Alpin, lots of mental health charities were under a huge amount of strain financially in terms of lack of resources before the pandemic. So they're in a much worse state than they were. Are they able, is there the sort of support that Lottie needs out there and available? And are the charities getting the financial aid that they need?
Money and Mental Health, we're very fortunate to be in a stable financial position, but sadly, I can't say the same for many of my peers across the charity sector. We do rely in this country a lot on charities to provide mental health support, the bigger organisations like Mind, but also lots of smaller national charities who've had their fundraising hit really hard by this pandemic. And it is really important that we do make sure those charities get the funding they need and deserve so they can provide the support that people like Lottie need.
Leon, you've talked a lot about your experience as a professional sportsman. How key is sport in trying to help people tackle their mental health problems? It's something that we know is important, but of course there are restrictions on team games, or on what people can do in certain lockdowns. But would you urge people who are watching this and who are feeling anxious or sad to get out there and make sure that they do get exercise?
I would say, because listen, not everyone's into fitness, but if there's a time where you're not, I think let's try and find the time to maybe reinvent yourself and try and get into like a new routine. I think fitness is ultimately a massive key factor in how you feel, what you do like day to day. So I know we can't really sort of get out there. Not a lot of people obviously are in gyms confidently, but there are so many people like myself who will do home stuff at home. You can go online. There's so many things you can do to help your fitness journey. But even if it's going for a walk, just trying to take your time, be kind to yourself. Please don't beat yourself up if you feel like you're not doing like loads of HIIT sessions and loads of boxing sessions. And take your time, understand what's going on, but little and often will be the best cure for you. My actual motto: fight it, get help, talk, so you can talk on a walk.
Oh, I like it. Okay, Liam, whilst I've got you, just because I really want to get through these extra questions before we run out of time, but Jamie Johnson sent in a WhatsApp, and I'll just skip through to the key bit where he said kids' football is one of the very few pieces of normal life that kids have left at the moment, never mind the adults involved. How can work and school be allowed to continue for many, but kids playing sport cannot? Just your thoughts on that, Leon.
It's such a difficult situation, as even Doc says, like, the virus is, my dad has got the COVID-19. My dad's 65 years old, former British European champion, and I've never seen my dad so weak. It's a serious situation we're in right now. And the kids' situation and the schools and, the sports, so even as I was explaining about my daughter and everything that's going on, I just don't know why schools are even open right now. I just feel like kids are getting sent home. The kids can't do the sports that they want. They can't do group stuff. It's all kind of over the place. There needs to be some kind of like, right, okay, what can we do to move forward? I just think some kids are at school, some not. Some people at work, some people are not. Like, what's the best solution now? Because right now, I don't see any growth in that respect.
Okay, Dr. Allin-Khan, just a quick final thought to you. It's World Mental Health Awareness Day tomorrow. My son's school, for example, today, all the children went in wearing yellow to raise awareness for it. They're trying to raise money as well. But how important are these sorts of awareness days, and also the importance to keep that awareness for the other 364 days of the year?
Oh, you've hit the nail on the head. This is an issue that affects everybody's lives every single day of the year. But I think it's really important to have days that focus the mind and enable us to have really important conversations like today, because my hope is that if just one person is watching tonight that goes, I don't feel so well, but I've had an amazing panel today say that it's okay not to feel okay. I'm not alone. I can go and get help. Then it's job done, isn't it? And look, it's a journey. It's going to take a really long time for mental health to truly get parity of esteem with physical health, for people to really give mental health the focus that it needs, and understand that without good mental health, we can't have our children fulfill their potential. We can't have people living happy, healthy, physically healthy lives. And it's so important that we have honest conversations, that we reduce the stigma, that we have our children going to schools and talking about it. Let's normalize talking about our mental health.
Okay.
And let's make sure that we do everything we can to put mental health at the heart of the agenda.
Wise words indeed. Dr. Allin-Khan, Leon McKenzie, Katie Alpin. I could talk to you for so much longer, but we are out of time. Really appreciate your expertise. And I do want to bring in now a psychotherapist, Lola J. She's also an author, and she set up a petition